Very good. And in that same vein, I know there's been lots of conversation about the vaccine as it relates to women and pregnancy. Can you walk us through that piece?
That is such an important point. I want to be very clear that the vaccines do not cause infertility. That was a hoax. It was a made up thing that has scared people to death. It's so unfortunate that a lie like that could undermine people's health. What I do want to be clear is that COVID is dangerous for pregnant women. Not only does it increase the mortality rate, we've lost a lot of pregnant women over the past few weeks, but it markedly increases the rate of miscarriage, it increases the rate of premature birth, and it increases the rate of preeclampsia by a remarkable amount. COVID is very bad for pregnant women. It's dangerous for your pregnancy. Even if you've had it before and get over it, there's evidence that it can be harmful from my discussions with people at UMC in your future pregnancies. The same thing with male reproductive health. The COVID vaccine does not impede male reproductive capacity or sperm counts, but COVID, the virus, does invade your testicles and can lower your sperm count. So COVID is bad for you, but the vaccine can prevent those things.
Dr. Dobbs, there's a question about sickle cell patients. Talk to us a little bit about the vaccine in sickle cell patients.
Yes. So, if you have sickle cell disease, we know that you're at increased risk for adverse outcomes from COVID. Absolutely recommend the vaccine for folks with sickle cell disease, and would suspect that, um, and would recommend go ahead and be looking at a booster dose for people who've had it for, some months ago. Uh, Sickle cell disease does weaken your immune system by several different mechanisms. One of them is because it does damage to your spleen over time. That is the spleen is an organ that's part of your immune system, and so without that, we know that that's one of the reasons that CDC reviewed of a weak immune system that would probably necessitate a booster. So absolutely. And one of the things that people have said to me, which I think is really sort of backwards, is that I think is a misunderstanding, is that if you have a weak immune system, people say, well, I'm just too sick to get the COVID vaccine. That's absolutely the reverse way you need to think about it. If you're underlying have sickness or some immune problem, you're the person who needs the COVID vaccine more than anybody. We know in the studies that they included folks with a lot of underlying medical issues and they didn't have extra problems, but we know that people who have those issues get COVID, they're much more likely to have problems, go in the hospital, or sadly even die.